Good day. I'm Justine Caliva.
And I'm JC Rufino, and today we will be discussing about Salmonella. To give an overview about our report, we will be discussing about the description, pathogenesis, and epidemiology, and therapy and research for Salmonella. So Salmonella is a microorganism that can be pathogenic and commensal for humans and many animals. It can cause diseases when acquired orally. They are typically transmitted through contaminated water or food from animals and animal products to human. Medically, Salmonella causes enteritis, systemic infection, and enteric fever.
Salmonellas, known to be a unicellular organism, belong to the kingdom Bacteria. They are under the phylum Proteobacteria, which consists of gram-negative bacteria. Moreover, they also belong to the class Gamma Proteobacteria. They also belong to the order Enterobacteriales and family Enterobacteriaceae. To this date, there are two known species of the genus, which are named Salmonella enterica and Salmonella bongori. Salmonella are rod-shaped, non-spore-forming, facultative with varying lengths. Salmonella have petricous flagella. As you can see in the picture below, petricous bacteria possess multiple flagella that grow at any point of the cell body, which allows this specific bacteria to move. They can also survive in freezing water and are resistant to certain chemicals that do not permit the growth of other enteric bacteria. These compounds include brilliant green and sodium tetracyanate. Including these chemicals to agar media can be useful to select and isolate Salmonella species. They were originally classified according to different aspects. They are known and italicized as binomial nomenclature Salmonella typhi and Salmonella typhimurium, which should be emphasized that is wrong since typhi is only a serotype and not a specific epithet. They were first subdivided into 7 subspecies. The 2 species, S. enterica and S. bongori, were formerly classified as a subspecies 5. The S. enterica subspecies 1 is the usual cause of most human illness with Salmonella. Lastly, Salmonella can be classified as either typhoidal or non-typhoidal. Typhoidal serotypes are those that cause typhoid fever. Salmonella can be described differently when cultured into different media. Salmonella colonies can thrive even in simple agar. In a nutrient broth, Salmonella produces turbidity. In a nutrient agar, as presented in the picture, they can be described as translucent, opaque, smooth, and circular. McConkey agar is selective and differential to non-fermenting gram-negative bacteria. MC agar produces colonies of Salmonella, which tells us that they are non-lactose fermenting, gram-negative colonies. In Salmonella agar, on the other hand, the colonies are circular with black at the center indicating their presence. Salmonella is an anaerobic bacteria, meaning they can survive where the oxygen is absent. Moreover, its carbon source is citrate while its nitrogen source is from lysine. During human infections, Salmonella uses glucose as an energy source for growth and reproduction. As explained in the MC agar, they are almost non-lactose fermenters, as well as non-sucrose fermenters and oxidase negative. They also ferment glucose and mannose to form acid and sometimes hydrogen sulfide gas. For their niche, Salmonella is most commonly found in the intestines of human and farm animals, though it can survive almost anywhere, including in soils and feces, as long as there is organic matter.
And now moving on to pathogenesis and epidemiology. As for the route of infection and transmission, non-typhoidal Salmonella can be acquired from many different animals as well as from the environment. Animals may naturally harbor Salmonella in their intestine without obvious disease, and animals that typically carry Salmonella include food and farm animals such as poultry, pigs, cattle, and other pet animals. On the other hand, humans acquire the bacteria via the oral route, and thus the sources of infection include fecally contaminated food and water. Moreover, transmission occurs from either a person or from a carrier or an infected person to others. These carriers include feces of people with unsuspected subclinical disease and people working as food handlers. Likewise, it is well known that high incidence of Salmonella came from commercially prepared chickens. There are 3 main types of disease in humans produced by Salmonella. The first one is the enteric fever, or also known as the typhoid fever, which is a severe systemic illness caused by Salmonella typhi or Salmonella paratyphi. As for the signs and symptoms, enteric fever has an incubation period of 10 to 14 days. After this period, high fever of 39 degrees to 40 degrees Celsius, malaise, headache, diarrhea, constipation, abdominal pain, bradycardia, myagria, and large spleen and liver manifest. Rose spots in the chest and abdomen are also seen, as well as normal to low white blood cells. Another disease caused by Salmonella is the bacteremia and vascular infection that occurs in approximately 8% of patients with non-typhoidal Salmonella infections. Its symptoms include rapid rise of fever, spiking septic temperature, infection to vascular sites, and persistent high level of bacteremia or bacteria in the blood. Last is the enterocolitis, which is the most common manifestation of Salmonella infection. After the incubation period of 8 to 48 hours, nausea, headache, vomiting, and profuse diarrhea of 3 to 7 days would manifest. There is also a low-grade fever of 38 degrees to 39 degrees Celsius and abdominal cramping. Presence of leukocytes in microscopic stool examination can be seen, along with inflammatory lesions of small and large intestine. The incidence and mortality of enteric typhoid fever due to Salmonella typhi and paratyphi vary significantly by region. Lowest rates are in developed countries such as the United States, Canada, and Western Europe. On the other hand, over the past decades, reported cases of Salmonella infection has increased worldwide, particularly in third world countries. Detection methods for Salmonella are fresh specimens such as freshly passed stools, blood, bone marrow, urine, or intestinal secretions. These are the most common and widely used method in the laboratory diagnosis of Salmonella. Other detection methods utilizes bacteriologic methods of isolation of Salmonella, serologic methods, and lastly, nucleic acid amplification. In treating diseases such as Salmonella, antibiotics are widely used. Uncomplicated enteric fever is prescribed with oral azithromycin, while patients with complication are hospitalized with parental third-generation cephalosporin or fluoroquinolone for at least 10 days are prescribed. Non-typhoidal Salmonella bacteremia is prescribed with cephalosporin and fluoroquinolone as well, whereas endovascular infection is treated with intravenous ceftriaxone or ampicillin or fluoroquinolone for 6 weeks. For severe diarrhea cases, replacement fluids and electrolytes is essential. Lastly, for susceptible organisms, oral therapy with amoxicillin, trimethoprim sulfamethoxazolone, or fluoroquinolone is advised.
Fluid intake is highly advised to replace fluid loss due to diarrhea for mild cases. For cases that are more severe, hospitalization and intravenous fluid might be needed. To avoid antibiotic resistance, antibiotics can be used for treatment but only for vulnerable patients. For prevention of the spread of bacteria, sanitary measures should be practiced. Personal hygienic precautions must always be observed for food handlers. There are also vaccines available to fight Salmonella infection, which are called PY21A and VICPS. Vaccines are advised, especially when visiting other endemic places. Just this August 2021, there has been a report of case of acute infectious pancreatitis associated with Salmonella typhi in Madagascar. Pancreatitis is usually caused by alcohol use and lithiasis, so its association with bacteria Salmonella typhi is considered as a rare complication. The patient had diarrhea, vomiting, and severe abdominal pain. CT scan showed pancreatitis. Because of the presence of diarrhea and abdominal pain, the doctors thought of possible Salmonella and ordered blood and stool culture tests, which consequently tested positive to Salmonella. This is all for our report on the bacteria Salmonella.